Okay, so this video captures 100% of what I talk about all the time, which is fraud, which is people putting in fake information. Here it is live on ABC News. Yeah, let's take a look at this.
All right, let's go ahead and pivot now to Washington, where the Justice Department charged hundreds of defendants with healthcare fraud worth $6.5 billion. And Alex Mallon covers all things DOJ for us, and he's following this. All right, Alex, so let's start with what this health...
Again, if you've seen any other my other videos, I've talked about how there were fraudsters putting in fake applications with fake information, names, birthdays, social security numbers. They're going to talk about some doctors here, but let me tell you, it falls in the same category.
Healthcare fraud is all about. What exactly is the DOJ cracking down on?
Yeah, I mean, Gio, we know how much money goes into the medical industry. If you take a visit to the doctor yourself or you take a family member, you get these bills back and the costs can be absolutely astronomical. What we're talking about, though, here is fraud, and specifically the Justice Department trying to root it out in terms of Medicare fraud and Medicaid fraud, the payments that come from the federal government to reimburse doctors or providers of medical.
Okay, remember, this is the doctor's side of billing, and this is the billing departments that everybody always has an issue with.
Care for either seniors or lower income people. And they announced a series of these charges yesterday in cases that date back several months, some of which are not at all related, but they do cobble them together in these so-called national healthcare fraud takedowns. And that's what was announced yesterday to the tune of about $6.5 billion, the Justice Department says, in a series of these cases, largely relating to providers or doctors making fraudulent claims, saying that basically, I want this money from the federal government to reimburse me for either care for a person that I may have cared for or a medical device that I ask to be reimbursed for. And what the Justice Department says is that often these...
And right there, healthcare.gov. What is fraud and the federal government have in common? Oh, wait, it always takes place together. The amount of fraud that takes place in the private industry is like very, very low because it's a private industry and they can check medical records. They can see if people are lying. They have to verify information. That's been that way since the very beginning of health insurance, before the federal government tried to step in and create a program. And then, of course, we all know how much fraud goes inside of the state and the federal government anywhere you go.
Cases are rife with fraud, people making claims for people who don't either exist or did not even have to have the treatment that the doctors supposedly prescribed. And that's the cases that we heard from yesterday from the Justice.
And this is why a lot of people are cracking down. A lot of companies are cracking down on people's claims because of this kind of things. And they want to say, well, that's not covered. And they've got to put more and more detail into it. But again, the reason our healthcare system is jacked up is a handful of reasons. Pricing. No one is price gouging. Whether you want to believe that or not, that's fine. But I'm telling you right now, you look at United Healthcare, their profit margin's 5%. Like almost the only companies that run on a 5% profit margin successfully are restaurants. Okay? So you need to look at it from that perspective. And the federal government stinks at holding anybody accountable. So that's why you have the federal government plans, whether the subsidies are there or not. If you actually get a subsidy, you can see what the total cost is regardless. That's why it's double the price. It's because it has no risk pool and they're lumping all the unhealthy people together and there's so much fraud going on. It's insane. Hey, thanks for watching the content. If you want to have better health insurance, whether pricing or coverage, you want something different or new, you want something where you feel like you have hands-on support from a live agent in the actual process of getting the policy and the post part of actually filing claims, please go to our website, click on the link below, or fill out our lead form. You'll catch a live agent. Our focus and intention is service, and that's all we focus on. And so if you want to work with someone who will hold your hand through the entire process of getting your policy to helping you file claims when that is necessary, you've got to work with us because let's just face it, we're the best.